Welcome to the Student Training Introduction to Your Rotation. The rotation you are about to embark on has elected to use a community-based APPE curriculum developed by the University of Arkansas for Medical Sciences and Idaho State University. This training video will explain how this rotation may be different than other APPEs you have been on in the community setting. This rotation will introduce you to community pharmacy practice from two different perspectives. The first is within direct patient care. This may be what you're most familiar with or expecting on an APPE rotation. You will learn about the pharmacist's roles in dispensing prescriptions, how the pharmacy works, and other business-related matters. The second is an enhanced service project, and this perspective is from a business innovation, how the pharmacy is pushing forward and in new areas and in new ways to serve their patients. You will be spending part of your time in each of these areas. This will depend on your rotation. Some may have you spend 50% of your time on each project. Some might have you spend 60% of your time on direct patient care and maybe only 40% on your service project, depending on what that project is. The main difference on this rotation is that you have protected time to help the pharmacy determine their service project needs and see that project to completion. Before you arrive on your rotation, the pharmacy has already completed a self-assessment to identify their business or service-related project and to determine the steps to achieve their goals. These may be intermediate goals or their long-term outcome goals. The pharmacy may also incorporate you and invite you to see their self-assessment and how they determined what their priority areas are. They've also determined the amount of time that you would devote to the project versus the direct patient care or other traditional pharmacy roles. And they have already created a schedule for you either on a daily or weekly basis. To provide you with a few examples of enhanced services that might be the subject of your project, here is a small list that was also provided to the pharmacies within the brainstorming session of their self-assessment. The types of activities you'll be asked to do is going to vary, of course, by the project chosen. But you may be asked to do a variety of different types of activities that you may or may not have completed before. So here are just a few examples. You may be asked to research and identify the best software or maybe a testing kit to purchase. This could be in the instance where a pharmacy has not started a service yet and they still need to buy some equipment in order to provide the service. You could be asked to help with determining the demand for the service and asking patients what they think and what they would like in order to see out of the service to make it useful for them. You might be asked to determine how do we identify the patients in need of our service and how do we market to them. You might be asked to do a couple of reports and running reports to see how many patients are already serviced or how many patients are maybe in need, depending on their prescription profiles. You could be asked maybe to help educate and train other pharmacy staff on that particular service. Each of these is going to depend on if this is something the pharmacy has done before or if they're already providing it and you're helping to evaluate the success of that program. Either way, you will be leaving a lasting impact on this pharmacy and helping them to make decisions on how best to innovate within the new pharmacy realm. I hope that you have an enjoyable rotation. Thank you so much.